Right now, how Donald Trump's picks to run two major health agencies could affect your health.
Also on Sunday Square Off, after a red wave sweeps Arizona, are Republicans done with election denial? Governor Katie Hobbs says she'll work with Donald Trump on immigration reform. How long will that last? And Arizona candidates are already lining up for top statewide races in 2026. Who's for real and who's not?
President-elect Donald Trump wants to install Robert F. Kennedy Jr. and Mehmet Oz, TV's Dr. Oz, in government jobs, roles that could have a profound impact on Arizonans' well-being to an extent you might not imagine. If formally nominated by Trump when he takes office, both appointees would require confirmation by the U.S. Senate. Will Humble, Arizona's former public health director, now executive director of the Arizona Public Health Association, joins us to discuss his concerns with the two nominees with the focus on Arizona. Welcome back to Square Off.
Morning, Brown.
So Bobby Kennedy and Dr. Oz would take over two vast bureaucracies. As simply as you can, what kind of impact can two individuals have on these organizations?
An enormous impact. You know, some of the things that the agencies within the Department of Health and Human Services would need congressional approval to change, but there's a lot of executive decisions that these gentlemen could make that could have a profound impact on how health care is delivered, what kind of drugs are regulated or not, how accessible vaccines are, a whole host of things that would affect people directly.
On their own, they can make that happen.
Right. These agencies have rulemaking authority. They can change regulations and rules. That might take about a year, but they can also prioritize different things that could have a real impact.
I want to provide a number. Let's start with Dr. Oz, the most recent pick. According to independent health policy researcher KFF, more than half of Arizona residents, 3.9 million adults and children, count on government-supported health insurance through Medicare, Medicaid, or the Affordable Care Act.
Right, the marketplace plans.
Half.
Correct. Well, I think it's higher than half. I don't know what they said.
It is higher, but
yeah.
Half. Dr. Oz would oversee those programs.
So, yeah, it would be, so first of all, it would be Medicare that he's overseeing. So this is, by the way, this is 22% of the federal budget, just that one agency, CMS. So Medicare, which is the healthcare delivery for seniors, some people with disabilities, they're responsible for that entire apparatus and regulating and making sure that's working properly. People are getting the care that they need, but also ensuring that it's not getting ripped off. So the fraud prevention is a big part of Medicare. Medicaid, they're in charge of ensuring that the states are operating their Medicaid agencies, in our case, Access, in accordance with federal law. And then they also regulate all those marketplace plans that people pay premiums for under the Affordable Care Act.
So what could go wrong?
Well, maybe nothing, but maybe lots of things. It depends on what Dr. Oz would want to do. What would he prioritize? What are his interests? And I think we'll find that out during the hearings. My biggest concern about Dr. Oz, really, fundamentally, which is different from RFK, which I think we'll get to in a second, is that he doesn't have any administrative experience. I mean, he was a surgeon, yes, that's true. He's been a doctor, and then he was an entertainer for, I don't know, 10 years, something like that. But he has very limited administrative experience, and he'd be running an agency that spends 22% of our federal tax dollars. Is that really what people want? To have somebody who has that limited experience running such an enormous agency and delivering services as important as healthcare for, as you mentioned, more than half of Arizona.
Now, there is Project 2025, which is the Heritage Foundation plan to overhaul these agencies, what they do, and in theory, Donald Trump will be hiring people to take on those tasks.
Right.
Which in itself could be a huge risk in terms of actual job competence.
Right. Well, and that's the question. What's Dr. Oz going to do? Is he going? If I were him, I would try to keep as many deputies in place as I could to keep my mission going, knowing how important the administrative functions are. If they clean house and you start over with new people, I don't know.
Let's bring Bobby Kennedy into the conversation. He has spread misinformation about vaccines, called their safety and effectiveness into question. He's done this for years. Here in Arizona, families have been rejecting childhood vaccines in increasing numbers over the last several years to the point where we might not even have herd immunity.
No, we don't have herd immunity
anymore
for things like measles anymore. Some of the diseases we still do. Measles is so contagious that we no longer have herd immunity. So if cases come in, like what happened in California a few years ago at Disneyland, you can have a cascade of cases which ends up infecting lots of kids. They miss school. There's a lot of implications besides just the really serious nature of measles.
So if confirmed, he would also be Dr. Oz's boss.
That's correct. So he would be the boss of FDA, Center for Medicare and Medicaid Services, CDC, National Institute of Health. There's a whole host of things Mr. Kennedy would be in charge of. My primary concern with him is different from Dr. Oz, which is that there's a long track record of Mr. Kennedy not using evidence to form his opinions, which that's one thing when you're a gadfly lawyer who has opinions about one thing or another, but when you're running an agency that is in charge of regulating vaccines and delivering health care, that's an entirely different matter. You don't need to be a doctor or a public health scientist or to be a good HHS secretary, but you do need to believe in evidence for driving your decisions, in my opinion.
And we've seen this with just about all of Donald Trump's picks so far, that evidence, experience, that kind of thing really isn't a prerequisite for the job.
Depends on, I mean, I've seen some of the nominees that I think are okay. In this case, I think he's grossly unqualified because of the way he makes decisions. Mr. Kennedy, I'm talking about.
And again, he could make a lot of decisions on his own.
Yeah.
And also use just the megaphone of that job.
And, right, so let's take, if we have time, talk about vaccines for a second. Most kids get their vaccines through something called the Vaccines for Children program in the U.S. There are many things that he could do. For example, changing the reimbursement rate for administering those vaccines that would make it so doctors just say, I'm not going to deliver vaccines anymore. So he doesn't have to remove vaccines from the FDA list. He could just make it so that it's more and more difficult for people to actually vaccinate their kids. And he has stated over and over, he doesn't believe parents should vaccinate their kids. I mean, this is totally contrary to everything we believe in public health and in health care.
Gonna have to end it there.
That was 8 minutes.
You want more time? We got to end it there. Will Humble, thank you so much for joining us.
All right, take care.